Hello and welcome to Newsline. For years, millions of pounds has been poured into AIDS research, but a small number of eminent doctors are claiming that we may have got it all wrong. One expert has even gone as far as claiming that AIDS isn't a sexually transmitted disease. The dissident medical professionals met in Amsterdam for a conference that's bound to annoy the majority of AIDS researchers. They claim that the HIV virus doesn't necessarily lead to AIDS and that the AIDS establishment has been going down the wrong path looking for a cure. Among those challenging the orthodox view is the French virologist Luc Montagnier, the man who first discovered HIV back in 1983. In a minute, we'll hear from an AIDS researcher who thinks the dissidents are wrong. But first, Joan Shenton reports from Amsterdam.
It's now 8 years since HIV was announced as the probable cause of AIDS. This summer, thousands of people will be gathering here in Amsterdam for the World AIDS Conference in July to discuss the latest research into the virus. But today, a very special group of scientists, a dissident group, is meeting to question the role of HIV in AIDS. Have we been wrong all this time?
We certainly went right. That is obvious from the results that we have gotten. We haven't saved one life, we haven't come up with a vaccine, we haven't achieved anything with the virus hypothesis.
In my view, HIV may have a role in AIDS, but there are a sufficient number of cases of people who have been diagnosed with AIDS without HIV to make me question whether it's even necessary.
The HIV paradigm has produced nothing of value for my life, and I actually believe that treatments based on the arrogant belief that HIV has been proven to be the sole and sufficient cause of AIDS has hastened the deaths of many of my friends.
This international symposium, called AIDS, A Different View, was held in an old Amsterdam church. 200 scientists, health workers and people with AIDS met to discuss differing views on the cause of AIDS. Professor Luc Montagnier first discovered the HIV retrovirus. Does he still believe that HIV is the prime factor in the cause of AIDS?
Certainly, I would say rather simply that without HIV there won't be any AIDS epidemic right now. HIV is the transmissible agent of the disease. I don't think there is a doubt for that.
But Luc Montagnier believes HIV needs cofactors in order to cause AIDS. And he admits there are many unanswered questions. For example, people can have HIV and not progress to AIDS.
We are seeing people which have been infected for 9, 10 years or more, 10, 12 years, and they are still in good shape, their immune system is still good. And it is unlikely those people will come down with AIDS later.
Although at least 90% of people who get AIDS in the West are from health risk groups, like some homosexual men and intravenous drug users, health authorities have chosen to concentrate not on the dangers of the drugs themselves, focusing instead on clean needle campaigns and warnings that the whole population is at risk because AIDS is a sexually transmitted disease. This theory was strongly challenged by Peter Duisberg. Is AIDS a sexually transmitted disease?
Absolutely not. There's no evidence for that at all. If it were, we would see AIDS in teenagers, we would see it in women, we would see it in heterosexual males, and none of this is happening in the Western world.
In the UK, the spread of AIDS through heterosexual sex in non-risk groups is virtually non-existent. The latest published figures show 54 reported cases in 10 years. It was thought that prostitutes represented a particularly high-risk group for the transmission of HIV and AIDS, but recent research shows that yet another hypothesis has been wrong.
There have been dozens of studies worldwide on whether female prostitutes develop either HIV or AIDS, and every single one of those studies in Europe and the United States has shown definitively that female prostitutes who do get HIV or who do develop AIDS are almost without exception, there are a few exceptions, but almost without exception, intravenous drug abusers. If they don't use drugs, they don't get HIV and they don't get AIDS, and they're seeing the same clientele.
Doubts about the role of HIV in AIDS spring from the fact that so few cells are found to be infected by HIV in AIDS patients.
HIV cannot be the cause of AIDS because it doesn't infect enough cells and isn't active enough. It's only found in 1 out of 8,000 T cells, which are often, not always, lost in AIDS, and that loss can't be due to HIV if only 1 in 8,000 cells are infected.
So if HIV can't cause AIDS, what can? Peter Duesberg believes AIDS-related diseases result from certain medical conditions and the toxic effects of recreational and intravenous drugs.
The only thing that's new in America, in fact in the Western world, in terms of health threats, is the dramatically escalating consumption of recreational drugs, which started after the Vietnam War and has increased over 100-fold in the last 10 years alone in the United States.
It is a behavioral disease. It's not a contagious disease. It is a disease that is linked to drug abusers, intravenous drug users, or oral drug users, and clinical health risk groups, like recipients of transfusions and hemophiliacs. It never spreads into the general population. That is a hallmark of a behavioral disease, a disease caused by drugs or toxins associated with that behavior, not an infectious disease which spreads randomly in the general population.
Michael Callan has been HIV positive for 9 years and is a long-term survivor of AIDS. He believes that many different factors can cause AIDS and describes how his doctor in New York, Joe Sonnabend, helped him.
I didn't want to look at my lifestyle, but when I read Dr. Sonnabend's really well-written, well-thought-out, what he did was he strung together a theory about what the cumulative consequences of an abusive lifestyle might be. And I recognized myself in the portrait that he presented. And it suddenly occurred to me the fact that by the age of 26, I'd had hepatitis A, hepatitis B, hepatitis non-A, non-B, herpes simplex 1 and 2, Shigella, Indiamoeba histolytica, Giardia, syphilis, gonorrhea, nonspecific urethritis, venereal warts, CMV, EBV, and eventually cryptosporidium and AIDS. I simply no longer, once somebody articulated the perspective that the cumulative effect of that might be disastrous for my body, it became impossible for me to pretend that that disease history was irrelevant to the fact that I was sick. It was sort of emotionally attractive to believe that it had nothing to do with any choices I'd made, that it was just bad luck. I'd accidentally slept with the wrong person. But once I was presented with a non-moralistic, calm, medical, rational presentation of a multifactorial mechanism which might account for my illness, I was never quite able to believe again that a disease of this complexity was ever going to have a single, simple cause.
The single, simple cause approach has led to very specific drug therapies with antiviral drugs like the controversial AZT or zidovudine, manufactured by the Wellcome Foundation.
180,000 worldwide now are prescribed AZT, a chain terminator of DNA synthesis, the most direct drug causing AIDS. AZT is simply AIDS by prescription. Recreational drugs are harder to convert into AIDS. That's what we call the long latent period. You have to inject cocaine on average 10 years to get sick, but AZT, it's enough for a couple of weeks or months. Sometimes it takes a year before enough of the bone marrow is killed that you are pronounced an AIDS patient from leukopenia, anemia, muscle atrophy, and serious nausea and weight loss because you can't pick up food anymore because your guts are intoxicated with AZT.
Luc Montagnier disagrees with Peter Duesberg about the toxicity of the drug.
AZT so far has proven to be the best drug to inhibit. There are some others now which are also in trial, but AZT was the first. So what I will do, or I will recommend, is to the patient, is to stay on AZT treatment because there is nothing better now.
In the warm Amsterdam sunshine, the 3-day conference generated some heated debate. By the end, the overall feeling was one of anger that scientific research should have locked itself in for so long to the single theory that HIV is the cause of AIDS?
I have the sinking feeling that I'm going to die as a result of the dilly-dallying.
The anger comes when I then think about the people who are dying, because this is not a question of simply pushing through the research to convince other scientists. This is a question that every month that goes by, we have several hundreds or thousands of people who died who might have been able to be helped if only we had gotten the research done earlier or convinced more people to move in this direction.
I would argue at a minimum that the absolute bankruptcy of antiretroviral therapy argues at a minimum that it's time to reopen the question and to start exploring other treatment strategies that are based on equally plausible models of disease causation.
Meditel's Joan Shenton reporting on the doctors who think the current thinking on AIDS is wrong.